What's going on, everyone? Happy Monday to everyone. Hopefully, everyone is doing well, staying safe, testing negative for all the viruses. If you did test positive, I hope you have a full and speedy recovery with no long term issues and no long COVID issues. It is time now for the Monday edition of the Pandemic Update for Monday, January 8th, 2024. That's right, we begin another week together in the middle of the winter surge of viruses and the ongoing COVID pandemic. If you're new to my channel, this is where we do the daily pandemic update. We talk about all the different viruses that could be of a health threat to you and sometimes other health news as well. Today's main focus will be the surge in viruses. So if you like this video at the end, give it a thumbs up and subscribe down below and share this with anyone who needs to see these videos. All right, we have a very busy news day and we do have some new data that is in as well, and we may or may not have Walgreens numbers. I'm recording a little bit earlier today, so Walgreens might not be in yet. That's fine if it's not. We'll get to that tomorrow if it's not in yet. Starting off with BNO, I have several things to show you from BNO. Weekly U.S. COVID update. New cases, 388,084 estimated cases. The average is now up to 320,000. That's up by over 35,000. State reporting 50 out of 50. In the hospital, 25,430. That's up by 3,833. In the ICU, 2,577. That's up by 306. New deaths. I really want you to remember this death number. 2,090. We're going to come back to this number. But 2,090 COVID deaths in the last week. That's ridiculous, but if you think that's ridiculous, I got more for you. All right. The breakdown for this week's case numbers, reports from 22 states, estimates from 28 states. It says here, COVID cases continue to rise across the U.S. with the highest numbers so far this winter, nearly 390,000. Other respiratory illnesses, including flu and RSV, are also at elevated levels. Over the past week, 35,000 Americans were admitted to hospital with COVID-19, the highest since January 2023. At least 25,430 people are currently hospitalized. According to the CDC, emergency department visits for COVID are the highest among infants and older adults. But despite high levels of infection, severe disease is down compared to the worst parts of the pandemic. And finally, they say, more than 2,000 new deaths were reported this week, which is, that's the 17th week in a row over 1,000, or nearly 26,000 during the same period. And the first week since March of last year, where more than 2,000 deaths were added. And let's go back to that death number again. It's 2,090. Why do I want you to remember that? Well, take a look at this. Let's come over to flu now. Weekly U.S. influenza update. 2.9 million flu cases were added in the past week, estimated by the CDC. Average 1,850,000 hospital admissions, 37,000. New flu deaths, 2,000. You take that 2,000, you add it to the 2,090 COVID deaths, that is 4,090 deaths just between COVID and flu in the last week. That does not include someone who may have gotten pneumonia. That does not include someone who may have gotten RSV. That does not include someone who got HMPV. That does not include maybe a tuberculosis case or anything else out there in the respiratory virus world. Yes, that's a lot of deaths. If you added them all together, even the ones that we can't see here, it's probably closer to 4,500 to maybe even 5,000 deaths just in the past week. That is totally ridiculous. I saw a tweet the other day, someone saying that, oh, I've had COVID multiple times, but I'm fine. I had flu, it was severe. It's because you had COVID. I mean, even Chris Como has admitted that anytime he gets something else that comes into his household now, because he had COVID, it's worse for him and it just doesn't go away. Yes, because you've had COVID maybe once or maybe even multiple times, it wears on your immune system, and something such as flu ends up being more severe than it would have been if you never had COVID. So yes, these death numbers in the past week, they're really bad. I mean, Over 4,000, just 4,090 just from COVID and flu, and yet no one is taking the initiative from the federal government, from the CDC, from the WHO, anywhere to do anything about it. They're just allowing this to happen. And quite frankly, it really has me upset, and it should have you upset as well. All right, moving on. We have a ton of news stories today. A Senator Maria Cantwell has tested positive in Washington. I don't know if this is her second case. It may be. I haven't checked my website to see if I have her added before, or checked or Google to see if she's added before, but something tells me she may have had this in the past. Someone leave a comment down below, or if I get time later on and check, I'll leave a comment down below. But Senator Maria Cantwell has tested positive. There is another person that has tested positive today. Well, no, not today. He tested positive last week, and that is Howard Stern now has COVID. And there is some significance to this. Howard Stern is someone it was admitted that last year, it was admitted that he had a phobia, like a real fear of catching COVID. He was really worried about catching COVID, and he would still mask everywhere he goes. And he even says that he doesn't know where he caught COVID right now, and that he was masked when he went to visit his mother. However, we all do know that, or at least I know, because he's on Sirius XM. I've seen some of his videos and live streams. He's not masking when he's in the studio. So that's telling me, I mean, I don't listen to him all the time. Once in a while, I'll catch a clip from him, and I'll just see that, hey, when he's in the studio, I'll have guests come in the studio, and he's not masking while he's doing his shows. So maybe that's how he got it. But currently, Howard Stern has COVID. He got it last week. He's saying he's past the 5-day period of being infectious, is still testing positive, and as we all know, if you're still testing positive, you could potentially be infectious. All right, moving on. We do have more to share. I believe this one's out of India. Yes, India is saying over 25% of kids who get COVID might have symptoms that stick around for a while, doctors say. So they're basically saying that in India, their long COVID rate in kids right now is 25%. We're not going to read this whole story. I do believe I either tweeted it or retweeted it already. All right, we have to go over to New Zealand now. Dozens of scouts catch COVID-19 at a jamboree. You know how in America we have Boy Scouts? Well, they have something similar over in New Zealand as well. A lot of countries actually have Boy Scouts. I was a Boy Scout when I was a kid. The number of scouts at a jamboree in Hamilton who had come down with COVID-19 is now being reported as 48. So 48 have tested positive, but I want you to note something here. We may very well see an update from this. This jamboree had 4,000 scouts. If there's 4,000 scouts, this could really have spread. So we shall see if there are any updates to this. And now we come over to this. San Diego wastewater data shows COVID-19 cases more than doubled in December in San Diego. All right, that does it for today's news portion. We have to take a look at air quality values because there's a big storm system that's getting ready to evolve in the central states. It's going to move east. It's going to be a rather messy storm system. We see fireplaces are a big culprit for bad air quality in California today. Bad air quality across the Great Lakes, though not as bad as the mountainous regions of California. And take a look down here in Houston. I don't know if there's an active fire or something, but yeah, some bad air qualities in Houston today. Also, keep an eye on my other channel, Climate Data Report. I may do something there later this afternoon and or tomorrow on this storm system coming up and the next storm system. It's becoming a very active pattern, so it is warranting me to do a climate update, maybe. All right, taking a look here, as you know, wastewater, it's not doing too well for COVID. It's the fastest rising in the Northeast states. As you can see here, finally, there it goes. You can see the Northeast states are rising the fastest. You can see there's a huge concentration right along the I-95 corridor of red wastewater sites, which is not a good thing. And Ohio is just doing absolutely horrible. Utah is doing really bad as well, not just for COVID, for all of the viruses. It's really bad in Utah. All right, let's take a look now at Walgreens. Let's refresh this. Hopefully, we got an update from Walgreens. And no, we did not get the Walgreens update yet. That's okay. We will get in an update out of Walgreens maybe tomorrow. Moving on now, you can see here where deaths are rising in several states. Look at this. Missouri, New Jersey, Massachusetts, significant rises. Then you have Maine, Wisconsin, Minnesota, Iowa, Kansas, Oklahoma, and I suspect Virginia as well, and Maryland. I suspect we're going to see this be the majority of the states within the next week or two. Taking a look at influenza, influenza is in a growing state for the majority of the country at this point. Same thing with COVID. It's either likely growing or is growing in the majority at this point. Taking a look at hospitalizations in the past week, admissions 34,798. That's up by 20.4%. I want to think we're coming near the peak soon, but you know what? I'm not going to say whether we are or not because anything could happen. All right, I have to talk about this. EMS call volume 706. That's lower in Philadelphia yesterday. That's good. But the suburbs were just crazy busy yesterday. And as for today, today is really busy right now. Look at all these respiratory emergency calls. There's 4 of them in Montgomery County right now. It's pretty busy in Chester County. I was listening to Center County earlier, which is, where Penn State University is, and it was just non-stop COVID calls between about 11 o'clock and 12:30 this morning. Then there was one call where, I don't know whether it was a husband and wife, but it was a household, 2 people positive, and one of them went into cardiac arrest while COVID positive. Yes, it's just absolutely insane right now with what's going on. And if that's what's going on in Center County, I have to imagine that's probably what's going on across the rest of the state as well. All right, moving on now, taking a look at New Jersey, and you're probably saying, wow, maybe New Jersey peaked, maybe it's dropped. No, 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 no. Don't get excited at that 645 number. It's actually a terrible number because that's only 29 out of 70 hospitals reporting. The rest of them did not bother to report today. So there's no sense of me continuing on here showing the rest of these numbers either because they're all meaningless numbers because not all the hospitals reported. New York State reported another 4,032 cases today. And taking a look at New York State last week, we have to note, and let me get the hospitalizations back up here before we take a look at admissions. We will not start the new week with New York State until tomorrow, but I have to note, yet again, hospitalizations to end a week last week did drop to, let's see here, 3,203. And if we zoom this out, that was on the 2nd, back on January 2nd, they had 3,403. That's the highest level so far with this wave. Now, if we zoom this out and go back to take a look, zoomed out a little too far. We want to take a look at last year. And we can see last year, on the 3rd, they peaked at 4,350. And we have to assume this year, not all hospitals are testing for COVID. So there may actually be more COVID cases right now than that number of 3,203, but the point I'm making is if 3,403 ends up being the highest level on January 2nd, it would be within 1 day of last year that they peaked for hospitalizations. Not saying that's going to end up being the case. We'll have to see what happens with tomorrow, but if it does, it's within 1 day of last year, and that, my friends, is really super interesting to see that could potentially happen. And if we go back to 2022, in that year, they actually peaked a week later. So we'll see. Maybe they might see another big boost in hospitalization. I think it's possible, just warranted. Everything that we're hearing about ambulances, people being sick, the number of cases, wastewater rising in the Northeast. So I don't think they're quite at their peak yet. But hey, who knows? We only can wait until tomorrow. And hopefully tomorrow we will have Walgreens data. That does it for today's pandemic update. The moral of today's pandemic update is that, man, there are just a lot of deaths right now from all these respiratory illnesses. Way more than there needs to be. A lot of this can easily be prevented with a simple measure. Masking. Masking is something that's easy, it's safe, it's effective. Please wear one today when you go out in public, especially in a medical facility. If you learned anything today, give this a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs to see this content, share this with your friends, family, anyone that you know. And if you have a comment, leave it down below. Let me know what you're thinking right now. Are you fed up with how many deaths there are? I certainly am. Alrighty, guys, I will see you all again next time. Until I see you again next time, which will be tomorrow, stay safe, everyone, and have a fantastic Monday afternoon. Thanks for watching.